Hi, I'm Dr. Jeffrey Hall at Austin Hair Graft, here today to talk about the role of Sunetics in my practice.
Hi, my name is Tricia Hall of Austin Hair Graft in Austin, Texas also.
The Sunetics Laser is an important part of our practice in that we have a hair restoration business and been doing this for a number of years, and we found this, the Sunetics Laser is something that really has enhanced our practice and that our patients are getting better results.
And a couple of testimonials that I would like to talk about is we have a patient and she was managing how much hair loss she had in her shower drain. And so she came into our office one day and she showed us different baggies. And in one baggie she said, "This is how much hair I had when I started using the laser. And now this is how little hair I have in my shower drain after using the laser for just a few months." So we love hearing amazing results like that from our patients.
Well, I think it's an important question to ask is why do we have this in our practice? And I think understanding the let's say mechanics of how it works is important. And from a science standpoint, what it's going to do for our patients, both the patients that haven't had hair transplants as well as the patients that have had hair transplants, it's going to give them a better result. The way the laser is going to work, it's going to stimulate blood supply to your scalp, which the way I sort of look at it, it's going to give you more fertilizer to your hair. So that hair follicle, which may have had some problems surviving, now can be sort of improved and it can live and give you a better quality hair shaft. And then at the same time, we use it in all of our hair graft patients where they come in, they have their transplants, then afterwards we'll treat them with the laser, and we've seen a lot of better results from that as well. Well, I think a lot of times people assume that when they have a problem with their hair, they're going to go to the dermatologist. And I just want to say that with the hair, you can use the Sunetics in other specialties. So in my specialty as a hair restoration surgeon, plastic surgeon, it fits very well. And I think other specialties could also use this modality in the same way. Well, I think sometimes there are areas for the use of the laser we don't really even think about. And I've learned this on my own experience in that I've got patients that I'll do, let's say, surgery in their face or things to rejuvenate their facial area. And what we sometimes miss out on is their hair. So if we get a nice result with their surgery or their skincare, but yet their hair is lacking, it's not good. So I think the Sunetics Laser has allowed us to sort of, again, enhance their result in the end by doing a treatment which is going to complement what we've already done. I think one of the nice things about the laser is it's a very simple thing to do. It's just a matter of time. So our patients come in and are able to sit under the laser in 20 to 30 minutes and get a treatment. And I personally have done it many times, and I've seen results. Basically, you know, my wife and other people have said, "What have you done to your hair? It looks better." And I can think to myself, it's just a matter of I was using the laser. So I think it's another thing for our patients to do. We can do the laser treatment, and then other people aren't going to really know what they're doing, but in the end they're going to see a result and that their hair is going to be, let's say, healthier.
I can also say, as Dr. Hall's wife and working with him every single day, that I can see a difference in his hair. Even with the blonde hair, you can still see that it's thicker and it's healthier and it has fuller body.
I mean, the way I look at it is the Sunetics is sort of a game changer. I mean, we can do the treatments like the transplant and get good results, but I think this is the way you can take it to the next level and get excellent or the best results for our patients. One thing I can say is that the Sunetics Laser takes it to the highest level. It is something that we have found and verified with the ProScope, which Trish is going to talk to you a little bit about, that we can verify that we get results, not just looking at the hair, we can see objectively with a study, and the ProScope does that for us.
So these are just a couple of tools that I use when I'm consulting with my patients. This is a chart that shows a nice healthy hair follicle, and once our hair has been affected by DHT or hormones or stress, then it becomes thin and brittle. So this is another great tool that we have. It's called the ProScope, and it really gives our patients an opportunity to see the quality of their hair. We can put it on the back of her scalp, and when she looks into our camera or into our computer, she can see the nice healthy hair follicle, because normally this area of the scalp is not affected by the DHT or the hormones, so it's nice and healthy. Then we bring the ProScope up here, and again she can see the quality, that there's a big difference between back here and up here. And so by using the Sunetics Laser, we can see the small brittle hair follicles that will be enlarged by using the Sunetics.